The person or family who will not immediately benefit from the Affordable Care Act known as Obamacare. You don't need maternity, chemical dependency, alcohol, drug abuse, mental health, or coverage for serious pre-existing conditions. So why in the world would you want to pay these huge premiums for stuff you don't need? Let's take a look at the typical bronze plan. The plan costs anywhere from $700 to $900 a month for a typical 45-year-old family of 4. That's roughly $10,000 a year. And in addition, it has a $13,000 deductible. So nobody wants to be out $23,000 before they get to 100% coverage. In fact, listen up. The Forbes article said 64% of people who bought Obamacare last year bought the least expensive or second least expensive plan available. The point being, people can barely afford it as it is. And with 19 to 22% rate increases a year, you'd better be really sick to pay those kind of rates. People that are sticking to this approach are having to make compromises. They're switching to HMOs and skinny network plans. And unbeknownst to them, these plans are not widely accepted and flat out not taken at life-saving centers of excellence like MD Anderson Cancer Center over in Houston. In fact, their website point blank says they don't take any low-cost Obamacare plans. Wow, that is not what I want for my family. No, you're smart and you want a better way. You're the kind of healthy person who wants affordable protection, freedom to choose from a large PPO, and flexibility to choose the deductible and out-of-pocket you want, not something picked from you by Washington. What you want is health insurance like it used to be before Obamacare. And I have it. Let me show you what I do with my family. Let me show you a more comprehensive way of protection, protecting you 6 ways in that pyramid instead of 1. Let's look at our family protection grid again and what I call the family rescue plan. I have 6 protections here. I have the short-term medical, which covers my medical bills. I have a living benefits plan that covers my living expenses, which are personal bills and mortgages and so on. I have an accident plan that takes my deductible down to only $250. I have a hospital recovery plan that pays me up to $999 a day for each day I'm in the hospital. And I don't overlook my everyday needs. I've got 24-hour access to physicians for things like doctor visits so I can get prescriptions. And I don't neglect my teeth. I maintain regular visits with my dentist and have dental insurance to help me pay for that. All of this you can get while saving $1,500 to $3,000 or more a year over a plain Obamacare plan. I call that real-life pyramid protection, and it's centered around the options within Obamacare law itself to opt out and be insured with a short-term medical plan that is valid up to 1 year at a time. You see, with those large rate increases, everybody is shopping over at healthcare.gov every year anyways. So let's make our decisions 1 year at a time. Each January, let's evaluate our situation. Are we sick or are we healthy? And we'll make the best financial choice. If we're sick next year, we'll use Obamacare as our high-risk pool, and we'll pay the higher price if and only if we get sick, and only for that family member who needs it. Otherwise, we take advantage of our good health and better protect ourselves for when our time comes, because it's just that, a matter of time, before the wheel of medical misfortune strikes. So I want to be better positioned the best way possible for when that happens. So let me show you our family protection grid and show you some examples between an Obamacare type plan and our pyramid protection. Example number 1 I'm going to use is a 45-year-old family. So let's start with the man. He has the Affordable Care Act Silver plan, let's say, and he has a moderate heart attack at age 50. He would have an out-of-pocket of $6,600. If the man made $90,000 a year and was unable to work for 4 months, he'd also have lost income of $29,700. So his financial setback, his negative cash flow, is $36,300 in arrears. The Affordable Care Act plan has 0 reimbursement, That means he needs to go into debt or dip into his savings to survive. Our real life pyramid protection plan, based around the short-term major medical, has a $5,000 deductible and $5,000 coinsurance. So he's out $10,000. Again, if he makes $90,000 a year and he's unable to work for 4 months, he has $29,700 of lost income. That's a financial setback of $39,700. But wait, our real life pyramid rescue plan also has the Transamerica Living Benefits Plan. The estimated accelerated payout for having that heart attack at his age is $84,857. That means he gets a check for $84,857 just for having the heart attack. In addition, he had our hospital recovery plan that was paying him $900 a day. So based on his hospitalization of 8 days, he got an additional $7,200 for a total positive cash flow of $92,057. Once he paid his negative cash flow, that left him a net positive income of $52,357. So let me rewind that. The man has regular Obamacare. He's out $36,000 out of his pocket. He gets our pyramid rescue plan. The real life benefits put him $52,357 ahead. Ask yourself a question. Where would you rather be? Let's look at example number 2. Let's use this wife, a 45-year-old woman who has severe breast cancer at age 50. The typical bronze or silver plan would have her with the same out-of-pocket of $6,600. But that's for 1 year. Cancer typically goes from the 1 year to the next, so she really would have 2 years of out-of-pocket, or $13,200. The husband makes $90,000 a year, but he lost 50% of his earnings due to his additional household duties and time spent nursing his wife over the 18-month of treatment. What that really means is he has an income reduction of $67,500. His wife's breast cancer set that family back $80,700 in this example. Again, the ACA plan has zero reimbursement, so you must dip into your savings or go into debt to survive. With our real-life pyramid protection, based around the short-term major medical, let's do the math. We have the $5,000 deductible, the $5,000 coinsurance, we're out $10,000. The second year of treatment, because it was open enrollment in January, I was able to upgrade the wife's plan and put her into a silver plan with $3,650 out of pocket. The husband's still going to lose half of his income for $67,500 reduction. So their financial setback is $81,150. But with our pyramid protection plan and the living benefits, that $81,150 setback is offset by an accelerated payout of $150,907 in this example. What that means is, just for getting a serious breast cancer case, that wife was accelerated out of her death benefit $150,907 in cash. She had 15 days of hospital recovery at $900 a day for 2 years. That hospital recovery plan provided another $29,970 for a real-life positive cash flow of $180,877. After they paid their out-of-pocket expenses and took into account the husband's loss of income, they're still ahead $99,727. Point blank, Obamacare plan to our pyramid is a real-life difference of $180,877. That's rescuing your family. Now, let's take it down a notch and go to the daily needs. Let's use an example. The child breaks his arm. Okay, he goes to the emergency room. You've got a $6,600 deductible on that silver or bronze plan, potentially. With our real life protection plan, you have deductibles as well. We did a $5,000. We did some coinsurance. So you're out $5,480. But on our plan, we put that accident rider on there so that it pays 100% of $5,000. So with our real life protection plan, your out of pocket went from $6,600 down to just $480. That's a real difference of $6,120, and that's something that can happen at a moment's notice. On our next example, we're going to use the same 45-year-old woman who just has a common ailment like getting a hysterectomy. Let's say that costs $15,000. Very common thing, right? On her Obamacare plan, the typical bronze or silver plan, she'd have an out-of-pocket of $6,600. And that sets you back. With our real-life pyramid protection, we have that $5,000 deductible and the $5,000 of coinsurance. She would be out in this example $8,000. However, we do have the hospital recovery plan. We're paid 4 days inpatient at $900 a day, which offset that out-of-pocket by $3,600. So her real-life out-of-pocket was $4,400. So even on a routine thing like a hysterectomy, the real-life difference is $2,200 better with our pyramid protection. Okay, I want to go back to our family protection grid, and let's look at the premiums. I already showed you how you're financially far better ahead in these examples with the family protection pyramid versus the Obamacare or the ACA plan. But let's look at the premiums. I'm going to use a 45-year-old male, a 45-year-old female, and 2 kids in Bexar County. And I'm going to use a PPO plan because I want to go to my doctor. I don't want to give up my doctor. So the typical person would buy a silver plan, and the least expensive silver plan that has a full network currently is $907 a month. Also in this example, I'm going to assume that family has a $90,000 a year of income. So we're going to have Obamacare at $907 a month versus our pyramid protection plan, the real life answer. So the health insurance part, I did the $5,000 deductible, 70/30 coinsurance. That premium comes out to $260.42 when paid in a single payment. That's the monthly equivalent. In this hypothetical example, I put together a living benefits plan to cover the right side of the pyramid for the mortgage protection, for the cash needs for a catastrophic illness so that you don't go bankrupt and have no home to come home to. In this example, I put a $250,000 living benefits plan with a guaranteed rate for 20 years on both the husband and wife. This plan is subject to underwriting, and the rate may fluctuate a little bit based on your actual health. In this example, that premium for both of them is $77.22 total. I also put a family accident on there with a $250 deductible with 100% coverage to $5,000. I'll call it the boo-boo benefit. Honey, I need stitches, I got a scratch, whatever. This is $64. We also put a hospital recovery plan to actually give you a $900 a day, which you can use as income or use to offset your deductible. To cover both the husband and wife, $87.94. I put on there a beautiful feature called My Health Pass. This is like having a brother who's a physician. Literally, you have a concierge doctor 24/7, 365. You pick up the phone and you say, I'm sick, help me out, and they write you a prescription. You have unlimited consultations for the whole family for $24.99. And I'm not going to overlook the teeth. They're very, very important. The kids, the wife, everybody needs to go for their checkups and their cleanings twice a year, and occasionally they may get a cavity. This plan pays $100 a visit each time they go for their wellness twice a year. When you have a family of 4, that saves you a guaranteed $800 a year. The total premium for this family is $605.78 versus $907 for Obamacare. Quite frankly, if you're lucky enough to be healthy enough to qualify for a real-life pyramid, then by all means, click or call us, put your information in, let us specifically tailor a plan for your needs. One of our skilled agents will contact you right away and find out how much you can save.